winner for Best Newscast, the WB11 News at 10.
It's billed as a significant breakthrough in treating severe shoulder pain, and it's been successful in healing even the worst pain caused by serious tears in patients' rotator cuffs. Dr. Mike Rosen has more.
Last year, a bad fall not only left 70-year-old Ron Russo badly bruised and shaken up, but as he hit the ground, he tore his rotator cuff.
No movement to speak of with the arm, but I could swing it back and forth. I couldn't lift anything up, couldn't bring my arm up like this.
Ron says he felt crippled, unable to do simple everyday tasks like combing his hair or reaching to put dishes away. He was desperate to regain mobility in his shoulder. When physical therapy and rounds of injections failed, Ron opted for a breakthrough arthroscopic procedure which repairs severe rotator cuff tears using a special implant called TissueMend. The implant actually reinforces the repair of soft tissue.
TissueMend is a biologic tissue augment which is applied to the rotator cuff. The problem with these chronic, massive rotator cuff tears is that the tissue is very poor. When a muscle is detached from its origin or from its insertion, the muscle withers away.
Surgeon Dr. Richard Seldes of Forest Hills Hospital explains that TissueMend is essentially a scaffold of collagen.
Everyone has collagen in their body, in their tissues, in their bones, and in their muscles and tendons. So the collagen network is something where the patient's own tissue can grow into. It's a graft. It grows into, and it becomes the patient's tissue over time. So it helps augment the deficiency of the tissue that's there in the rotator cuff.
One of the big problems with rotator cuff tears is that if the tissue remains poor and there's no soft tissue covering the joint, arthritis can develop.
Years ago, a lot of these rotator cuff tears were treated by open means. A large incision was made over the top of the shoulder, maybe about 6 inches. Now we do it through very small incisions. We're able to insert a large graft into the shoulder. We don't have to remove the muscles like we did in the past. So the rehabilitation is much quicker. The pain is much improved.
Ron says he has a new appreciation for life, having experienced it without the full use of his arm. He now takes nothing for granted.
I wouldn't be able to pick up my grandchildren and play with them, throw the ball to them, and now it's all changed.
I'm Dr. Mike Rosen.
And for more information, go to Dr. Mike's website, WB11.com/Dr. Mike.